Basic life support is a first aid technique that all DCHS community staff need to be familiar with and competent to undertake. It consists of a standardised sequence of actions that can be applied in all settings. The sequence is divided into two parts, SSS and ABC. Everyone has had the experience of mild choking, where a bit of food or liquid goes down the wrong way. This is easily sorted by continuing to cough until it is relieved. A severe choke, where the individual is unable to speak and is visibly distressed, is a potentially life-threatening situation. You can help by approaching the individual from the side, limiting the potential for being grabbed by the distressed individual, then asking, "Are you choking?" While this may seem obvious, it is always better to check rather than assume. Explain to the individual what you are going to do. Start by placing your arm across the front of their upper chest. If they are slim, you may be able to reach across to their shoulder. Otherwise, place your hand in the centre of their chest. Ask the individual to lean forwards. Using the heel of your other hand, strike them hard between the shoulder blades. You can do this up to 5 times. After each strike, check to see if the obstruction has come out of the mouth. If, after 5 back slaps, the obstruction has not been relieved, change position so that you are standing behind the individual. Make a fist with one hand. Wrap your arms around them so that your fist is placed just above the belly button, but below the rib cage. Cover your fist with your other hand. Pull inwards and upwards sharply. Ensure that your head is positioned above the individual's shoulder to avoid injury to yourself from their head moving backwards. This can be repeated up to 5 times. Check after each abdominal thrust whether the obstruction has been relieved. You can continue to alternate between back slaps and abdominal thrusts until such time as the obstruction is relieved or the individual loses consciousness. Whilst necessary, abdominal thrusts carry a risk of internal injury. Therefore, everyone who receives them must be advised to seek a medical review that same day. John kneels by the side of Mrs. Arkwright. He holds her shoulders and gently shakes her, speaking into each of her ears.
Are you all right? Can you hear me? Open your eyes. Hello?
If you are in a situation with a collapsed person and you are on your own, you will need to undertake an ABC assessment. Establish whether the individual is conscious, breathing, or in cardiac arrest before leaving them to make a call to the emergency services.
Hello, ambulance service, please. Could I have an ambulance? I've got a lady who's in cardiac arrest secondary to choking. I'm about to start CPR. We are at St Oswald's Hospital in Ashbourne, Derbyshire. Thank you.
To open the airway and make sure the tongue is not obstructing the airway, you will need to perform a head tilt and chin lift. This is a 2-stage process which involves placing your hand on the individual's forehead, applying some pressure to extend the neck, and at the same time placing your index and middle fingers under the point of the chin and lifting the chin upwards. Once the airway is open, look inside the mouth for any obvious obstructions. If there is an obvious obstruction at the teeth that you can pull out without placing your fingers behind the teeth, then do so. If the obstruction is behind the teeth, then leave it in situ until appropriate equipment is available. If there is fluid, such as vomit or blood in the mouth, either turn the individual's head to one side or turn the individual onto their side to allow gravity to drain the contents of the mouth. Once the airway is as clear as possible, maintain a hand on the forehead and move on to the assessing breathing. This is done by lowering your head down to just above the individual's mouth and nose. Turn your face so that your cheek is just above their face and your face is looking towards the individual's chest. Look for any movement of the chest. Listen for any breath sounds and feel for any breath on your face. Simultaneously, place your free hand gently on the individual's chest and move it over the chest, feeling for any movement. This process must not take more than 10 seconds. Circulation is not formally assessed, therefore we work from absence of signs of life. You are already aware that this individual is not responding to you from your stimulate from earlier. You can also look at the colour of the individual. They may be pale, bluish, or a mixture of reddish purple. Abnormal skin colour in combination with absence of signs of life is sufficient to establish no circulation. Absence of breathing and signs of life indicates that the individual is in cardiac arrest. Kneel beside the individual. Ensure that your knees are about shoulder width apart. Place the heel of your hand in the centre of the individual's chest. Place your other hand over that hand and lace your fingers together. Position your shoulders directly over your hands. Keep your arms straight and if possible lift your fingers off the chest. Now push hard and fast on the chest at a rate of 2 compressions per second, 120 per minute. Make sure you are compressing the chest by at least 5 centimetres, 2 inches each time. Let the chest rise completely before giving the next compression. Don't take your hands off the chest, just your weight. If you are on your own with someone in cardiac arrest, the only piece of equipment that you may have access to is a face shield. If you do not already have a face shield, you will be given one when you attend for your practical assessment, or you can contact the training team. In this situation, you will need to use your face shield to deliver rescue breaths. To deliver rescue breaths, you need to take the shield out of the packet and place it over the individual's face, with the writing facing you and the valve over the mouth. Ensure that the head tilt and chin lift is adopted. Pinch the individual's nose, make sure you have a good seal around the mouth and breathe out normally into the person's mouth for 1 second. See if the chest rises. Take your mouth away and watch to see if the chest falls. Repeat this once, then return to compressions. If you do not see the chest move, go back to compressions and try again after you have delivered a further 30 compressions. During working hours, you would always be expected to deliver rescue breaths using a face shield. DCHS would never expect you to deliver rescue breaths without using a face shield. If this situation arises outside of work time, it is your decision whether or not you deliver rescue breaths. The only disease that is proven to be transmitted via direct mouth-to-mouth is tuberculosis. At all times you would be expected to undertake an SSS ABC assessment, call for assistance and commence cardiac compressions.
Hello, Mrs. Arkwright. Can you hear me?
As the individual is now showing signs of life, it is necessary to repeat the ABC assessment. The health professional should gently do a head tilt and chin lift and have a look for any further bits of food debris in the mouth. As the individual is coughing, there is obvious signs of life, therefore you would not need to put your cheek down near the individual's mouth. You would, however, assess breathing by counting the rate for 1 minute, observing the rise and fall of the chest to see if it is equal and listen for any noises such as a wheeze. If you are able, you can also feel for a radial pulse at the wrist and count the rate and whether it seems regular over a minute. To place someone in the recovery position, kneel beside them on the side that you intend to turn them towards. Make sure the individual's legs are straight. Place the arm nearest to you out at right angles to their body, with a right angle bend at the elbow with the hand palm up. Bring the far arm across the chest and hold the back of the hand against the patient's cheek nearest to you. With your other hand, grasp the far leg just above the knee and pull it up so that the foot is flat on the ground. Keeping their hand pressed against their cheek, apply pressure to the far knee to roll the patient towards you and onto their side. Position the uppermost leg so that the knee is at right angles. Position the head so that the neck is extended and supported. A clear handover is a vital part of any ongoing care. The SBAR, SBAR, handover gives a concise summary of what has occurred within this situation and provides all of the necessary detail for the ambulance crew to give an effective handover to the hospital team. It stands for situation, essentially who you are and where you are. Background, brief clinical detail about your patient. Assessment, what had happened that has caused you concern. Recommendation, what you would like to happen to your patient. Just remember, SSS, check for safety, stimulate the person, shout for help. If on your own, do ABC assessment before dialing 112 or 999 to get assistance. Otherwise, send another person to make that call. The faster help arrives, the better the chance of survival. Place the heel of your hand in the centre of the chest, interlock fingers and press down 5 to 6 centimetres at a rate of 2 per second. Rescue breaths. Use a face shield. Lift chin, tilt head back, pinch nose and blow into the mouth twice for 1 second each. See if the chest is rising and falling. Finding yourself in a situation in which you need to give CPR can be a traumatic experience, no matter what the outcome. But knowing what to do will not only increase the chances of the person surviving, but also means that you are prepared for any situation that might arise. CPR can be frightening to do, however it can and does save lives. You can do no harm by having a go.